I will now call the Community Safety Committee meeting to order at 1:03 p.m. Eastern Standard Time. Welcome everybody to the first Community Safety Committee meeting with our new committee structures. A lot of us are very looking forward to seeing this new committee structure and its productivity with the way we set them up. So on the agenda, we don't have any open delegations today, but we do have a presentation concerning the update to the city's community safety and well-being plan. And I will now call upon Police Chief Kimberly Greenwood from the Barrie Police Service to approach the podium to provide her presentation on this matter.
Well, that's even easier. Thank you. Press the button. Okay. The red button. Good afternoon, everybody. Thank you very much for including me in your very precious time today. I was very happy to present this, and it's just a brief update on the community safety and well-being plan, but there's also some other things that I'd like to update members of this committee on the work that's happening in our city through the Barrie Police Service. If we could go to the next slide, please. The next slide is just a brief overview of the strategic plan and our priorities for the next few years. We have seen something similar to this in our previous strategic plan, but when it does impact council, I'd like to draw your attention to priority 1 in regards to traffic safety. So we have included this as one of our targeted priorities, and with each of our priorities and actions and objectives, we have assigned personnel to look after these objectives. So number 1, you see traffic safety, and then under priority 2, empower and strengthen community partners is also an area that the city would be very much interested in. And if you go to the next slide and you'll look at, you can see the connections between the Barrie Police Service strategic priorities and the city of Barrie's priorities under number 2, community safety. And we were very pleased to see that it did get the attention that we think it deserves. If you recall, many of you were aware of the provincial, next slide, please, the provincial legislation around the community safety and well-being plan. And this was a lot of great work that was done by individuals of the committee that was established by council under the direction of Chief Mainprize, with support at some points through Wendy Cook and a lot of support from Don McAlpine. So one of the next slide, please. And I'm going through this very quickly, cognizant of everybody's time. When we looked at bringing together working groups and our social services agencies that we work very closely with, these were some of the high-level concerns that were raised by businesses, communities, and the social agencies, and along with the members of the committee. So we talk about the opioid and drug addiction issues in our community, mental health issues, homelessness or living rough or near homeless, no affordable housing, poverty, food insecurity, and then there was a lot of discussions amongst the social agencies that there were challenges as the services were under significant stress. And this was developed just pre-COVID. Our last meeting when it was in development was just as the province was closing down. So we were able to continue to do some of that work. And if you go to the next slide, this is a snapshot of the partners that were involved in the community safety and well-being plan. So you have a copy of this, you can refer to it later rather than me listing all through them. If you go to the next slide, it lists our specific action items. A lot of work is continuing to be done in this area. And I will focus on a couple of items that the Barrie Police Service are involved in. So the next slide will highlight the development of a community justice center and the community services campus concept. And that's what I'm here to speak with you about today. So if you look at the next slide, this is what we're speaking to. We have our key community partners that were involved in the makeup of the community safety plan. And these are segments of our community that are going to support the campus concept. Next slide. In addition to the core partners that are sitting at the table, there's lots of other agencies that we can call upon to support the individuals in our community that are either at elevated risk or requiring support. So we did, next slide, please. We did seek funding through the provincial government, and we were awarded $1.5 million under the provincial strategies for police services across the province. This is the first time the Barrie Police Service has been awarded under a provincial strategy funds. We are successful at local strategies, but this was the first time from a provincial perspective. So we have, next slide, please. We put together a project that is going to be focusing in on bringing all of our social partners together in one physical location. So if we look at those that are in need, we can, we're calling it one-stop shop, so they're able to get the services that they require. Also, next slide, also embedded in the community services campus are justice centers. And when we look at the need in our community, we have done some research. We've gone to other jurisdictions to see what is working there. Sometimes we don't have to reinvent the wheel. So we look to examples across North America. And the first location that we went to was the Midtown Community Court, and that was in New York. And that has been established since 1993. And they were looking at how they could respond to, in the United States, that low-level offenses such as shoplifting, illegal drug use, and graffiti. So instead of fines or short-term custodial time, the Midtown Community Justice Center focused on sanctions with a restorative justice perspective. So their teams there include outreach services, housing services, drug treatment, mental health counseling, employee services. So there's a wraparound approach. Also, we did attend Red Hook Community Center, and that was, or Justice Center, and that was launched in 2000. And I can say that this is the center that is being used internationally to support this concept. So they also looked at things such as drugs, crime, domestic violence, even landlord and tenant. And when you looked at Red Hook, it was a small, tight geographic location, and they looked at coordinating rather than piecemealing their response out to deal with the concerns in the very tight geographic community. We also were able to head out to Vancouver and look at their downtown community court. So it wasn't a social services hub that I would like to see in the city of Barrie, but it was a community court which would be part of the embedded justice systems that I would like to see in our social services hub. So it's the first in Canada. And it was bringing health, justice, social services into one location as a designated courthouse. So it focused just on, if we use the same term as in the United States, that low level. So they were focusing in on alcoholism, drug addictions, mental health, homelessness, and poverty with a similar one-stop shop. All the services are available there. We also looked at Victoria, And similar, they were just in their infancy stages, so they're very much starting off with the same concept of police, health, social services, corrections, all working together to look after the repeat offenders in our community of those different low-level crimes. Next slide, please. When we are looking at what is happening in Ontario. So right now in Ontario, there's 4 pilot projects going. London is focusing in on youth crime. The northwest end of Toronto is focusing in on guns and gangs. The downtown east is focusing in on homelessness, addictions, similar to what we see a little bit in Barrie, and then Kenora is an Aboriginal lens to all of these issues. Next slide, which I think is the model that we would like to see in our community, is what is happening in Kenora. It has not launched yet, but it is one physical location that will have the justice center there. So there would be a defined judge, crown attorney, individuals that are in the community would come to this location if they met the requirements that were set out to seek drug treatment, seek housing, seek employment, then they would not have a conviction on record, but it would be that around holistic approach. And this we hope will launch in February of next year. So with the funds that we have collected, next slide, we're looking at, we have completed, and I'm not going to go through the things that we have completed because I've spoken a little bit to it. We're working with RVH in regards to a mobile crisis response team. We're working with our community partners through the Ministry of the Attorney General on some case management navigators through the system. We're looking at other long-term grant capabilities to keep this running, and we are looking to establish an executive steering committee, and this is where we may call upon council to assist with potential options available there. And we're looking at, and we're currently doing this right now, space in the city of Barrie to have this social services hubs. We have some funds to do some construction. Next slide, please. And then we will look to ensuring that we have our justice partners, all of our community partners together to highlight our next grand opening. In year 3, we're looking at having the community campus up and running with that full wraparound holistic approach to care for those that are vulnerable in our community. And in everything that we do with a requirement for any grant, we do have to have matrices and type of measurements in regards to what our long-term goals are. And the last piece is something that is in the next slide, please, that is embedded in the Barrie Health Accord is, we'll get to the next slide, thank you, is some work that was done with the Barrie Police Service and some of the partners that were part of the Barrie Health Accord, that being Dr. Gardner, representing public health, Jenna Scott from Royal Victoria Hospital, myself, the county, looking at what is happening in our communities. So can we look at what services are available? Can we do some mapping and analyzing what are the services that are here and looking to ensure that we are investing in the right area? So that's a quick update from not just the community safety and well-being plan from a city's perspective, but what the Barrie Police Service are currently engaged in to meet the needs of those vulnerable in our community, so they are not cycling through the justice system or responding and utilizing the services of fire and police, which is an agency that have multiple things that we're responding to. Thank you.
Perfect. Thank you for the presentation, Chief Greenwood. Are there any questions from members of the committee first and then non-members of the committee? Mayor Nettle, go ahead.
Thank you, Mr. Chair, and thank you to Chief Greenwood for coming today. Certainly, we had a great conversation about some of the items that have been covered today, and that's why I thought it was a good fit for our initial our first meeting of our new committee structure. There's a few things in the presentation that I had some questions about. In terms of a social services hub, I think is what it's referred to in there. Maybe Ms. McAlpine can remind me of the year because she's really good at that. But I believe that Councillor Prowse, then Councillor Strawn, or formerly Councillor Prowse, then Councillor Strawn, and myself moved a motion for the creation of a social services hub in the city of Barrie in 2012, 13, or 14.
Mayor Nuttall, thank you for the question. And I was thinking it might actually have been earlier than that in my recall, but I'll go with yours since you were involved in moving the motion.
No, I think you're going to be far better at this than me. You know, I believe there was $100,000, and I think it was a CMHC grant, if I'm recalling, and we got nowhere. And we are no closer today than we were back then. And so what has structurally changed inside of the organizations that need to work together that we can be successful today that we weren't successful called a decade ago? Maybe it was less, maybe it was more, but called a decade ago.
Thank you very much, Mayor. The motion or the work that was being done in the community just over a decade ago was pathways. I think that's what you're referencing. And I will say that I think our city and our community is now ready to embrace this. I think there has been a significant shift in those that are vulnerable in our community, whether it was through the pandemic and us having to change the way we offer services in the community, or the increase in the visual needs in our community. So we do have multiple, and if you reference the slide, it doesn't need to be pulled up, but we are working very closely with all the community partners, and they're all vying for the same dollars sometimes in funding, and they are servicing the same clients on occasion. But I think that there is a willingness to collaborate, to work together on this. And it's actually bedded in the requirement of the cities to have a community safety and well-being plan. So I think that adds a little bit more emphasis to it. And I think there's a willingness of many of the partners to come together to make this successful.
So I would agree that the community is ready for it. I think the community was ready for it a decade ago. My question is more about the actual organizations that were at the table and then walked away for various reasons, and the integration of those services. You know, a client-centered service and a client-centered approach where multiple services are helping to service the same client and sharing information, working through privacy issues that exist, all of those things that we heard about over the last decade for the reasons that it didn't take off. Has there been structural changes inside of those institutions, we'll call them, or those services that will result in a different outcome this time?
I think that we have similar people that were supportive of it before, and I think we have new people sitting at the table. And this is, you know, we have some funding and we have a coordinator that will be able to bring all of us together, so we address the challenges and the concerns up front, so we are successful.
Okay, has there been any outreach to the private sector with regards to support for this project?
Yes, there has been.
Okay, and has there been discussion with regards to a location?
There has been some discussion and that is still being worked on. I can say that we're not targeting in the downtown core per se. We're looking at other locations.
Okay. At one point, there was the principals over at More Packaging were looking at putting a group together to buy and donate a piece of property over in that area. And I don't think that ever happened because I don't think there was any actual operational funding to satisfy. If you can go build a building, but if there's no funding to operate it, then you're left with just a building. Is there been a change on that front in terms of the eventual operational funding, or is that what we need the organizations to be able to work together on in order to?
There's a couple of pieces too. So I'll break it down into, there's a couple of questions or a few questions in that. So from a physical location for this service community social hub, there's a couple of options. We are working with the private sector. They are looking at what is available for us. So that is taking place right now. We have the $1.5 million that will help with some operational funding of the project, but there's also the other physical cost associated with identifying and rent and possibility rent to own concept there. And the social agencies are working to see how they can support this as we start through the infancy stages of establishing this.
And when it comes to the organizations and going down this road, is there any sort of service level agreements that have been signed between the different organizations to say that they want to proceed? And I'm asking these questions. I'm trying to figure out where we're at, what stage of the process we're at before, before we move on. So is it like service level agreements are starting to be signed? Is it we're just bringing people to the table? And what would the projected timeline be to get from wherever we are in the process to an actual campus atmosphere?
Okay. So our target is by 2025 to have a physical operational campus hub model working. We're still in the year one. So we've done the research. We're developing a steering committee and which will lead to memorandums of understanding, service agreements, but we are not at that point yet. But that is part of year one transitioning into year two.
And finally, there was a slide that showed the different organizations.
Yes.
Are there any of the organizations that have not agreed to come to the table on this?
So the Community Services Campus Hub, which had the main partners there, they have all had some preliminary conversations in regards to the grant funding that we've received and moving forward on this. And then there's peripheral organizations on that chart too that may become involved if necessary on a case-by-case basis. But there's some core organizations, Canadian Mental Health Association. We were working with the Busby Center, Elizabeth Fry, Barrie Native Friendship Center. So there's some key organizations that are already embedded in a community safety and well-being plan. They're also part of this concept for the Community Services Hub.
And are they all in agreement at this point?
From a concept perspective, but we haven't got any documents signed.
Okay. Thank you. Thank you, Mr. Chair.
Thank you, Mayor Nettle.
Justice partners are also one concept of it for the embedding of the Justice Center too.
Perfect. Thank you, Mayor Nettle. I saw Councillor Hamilton next, and then I'll go to Councillor Harris.
Yeah, thank you. And thank you, Chief Greenwood. That was a fantastic update and presentation. And again, I think this has been years in the making. So I look forward to actually making some progress this time around. Picking up on Mayor Nettle's a couple of comments that he said, just in terms of the steering committee, the executive steering committee you mentioned, because I think that's critical. I think if we're really looking at getting momentum with this, it needs to be co-designed. And so my first question is, Who is leading this right now? Is it really being driven by Barrie Police? Because my perspective, I think where conversations fell flat before is that there seemed to be individual conversations and silos, and there wasn't a joint entity, a joint table where you had the private sector at the table, the community and social services at the table, health and safety at the table. So what is the timeline for this executive steering committee to come together so people can really be part of this in more of a co-designed fashion?
That's the point of coming to this committee, is to identify that this is what we're working on. That is the stage where we are right now.
To
is
develop that next.
developing
Okay.
The executive steering committee. We have had the social agencies met. We've had the private sector been meeting. We have spoken at a very high level at the Barrie Health Accord, but not to the new leaders that are part of the Barrie Health Accord.
Okay.
So we're at that stage right now.
Perfect. And then a follow-up question, if I may, has there been any conversation with the Ontario Health Team, like our local Barrie Ontario Health Team, OHT here? They have a mandate for integration for health services, and they fund a lot of health and social programs and services in our community. So I'm just wondering again, if there's opportunities for funding, an opportunity for them to be at the table considering their mandate. And I think this is where some of the challenge were in the past with these organizations coming together. There was a real hesitancy for health and social services to integrate. That has changed from a provincial perspective, and there's a strong focus on mandate for these programs and services and organizations to work better together under the umbrella of an OHT. So I do think they're a critical stakeholder, and I'm just wondering if you've had any conversations with them.
We have had no conversations with them at that point.
Okay.
Or at this point, but that's on our list of one of the peripheral players that could become a key stakeholder in this.
Great. Thank you.
Thank you, Councillor Hamilton. Councillor Harris.
Thank you, Chair Morales. Yeah, and further, great point, Councillor Hamilton. I was just thinking about the Barrie area OHT and them not being noted. Now, some of those people on that list are members and some aren't. So I think very important to figure out, especially with funding and incorporation of OHTs happening in the near future, that some of these partners who sit outside the OHT and some who maybe that's another question, maybe a comment. If there's a glaring omission, how would one go about getting involved in this initiative? Like who's the center?
As a social agency?
Well, and if there's more than that, feel free to add, but yeah. So
People
social
are
agency or
welcome
otherwise.
to participate in it, but we haven't done any community consultation to invite others in. We have been speaking to those that are already embedded in the community safety and wellbeing plan.
Okay. So second question, would the hope would be having a community services campus mean there'd be less concentration of services in the downtown core? Would that be one of the outcomes?
Potentially that could be an outcome, but it's about all of the service agencies working together. So there's not a duplication and people get the help that they need immediately. They're not waiting for support.
So that wouldn't be one of the outcomes. It would be like a redistribution of service throughout the city versus
My
the
personal
continuation.
goal
Yeah.
would be to have one central location in an area that's outside of the downtown core. But that would be up to individual organizations if they're just going to embed services in a central hub or they're going to offer both.
Okay. Thank you very much.
Thank you, Councillor Harris. Councillor Harvey.
Thank you, Chair Morales. The hub model obviously is a terrific idea. I know it's been attempted in other municipalities from a domestic violence standpoint, and it seems to work. However, where I've seen it fail in other municipalities when it comes to this hub style model is typically funding. Now, when you look at these other models that you've looked at, and it seems like obviously the two that you've highlighted in New York State are by far the longest standing. What type of funding models are they using so that way we can look at a program that's going to be as successful as theirs in last decades, opposed to 12 to 24 months like we've seen with other hub models when it comes to domestic violence issues?
There's different models available, but where we've seen is municipal funding and it's core funding. So it's not grant funded. They've been able to secure funding through their municipalities for some, and then others are basically applying for grant funding. So there's different models out there. I would hope at some point that it would be core funded.
Great, thank you. And just one other follow-up. Why 2025? Why do you think it's going to take that long before this is going to be able to get off the ground?
That's the end of the grant funding. So we want to have everything in place, up and running, having people through the doors at that point.
I guess my question would be, why can't we get it done sooner?
I wish I had a magic wand. How's that? My goal would to have it done sooner.
Yeah, I know sometimes, obviously, the more players you have, it does slow things down and make things a little more difficult. But ideally, I'd like to see a shorter timeline than 2025. But obviously, it'll take time for things to work out with the other partners involved. So I'll leave it at that. Thanks,
Thank
Chief.
you.
Thank you, Councillor Harvey. Councillor Rima.
Thank you, Chair Morales. Chief, thank you very much for that presentation and bringing us up to date on it. I think it's really an important initiative. And my question to you really is, what do you need from this council in order to make this happen?
Well, I'll do it in two stages. So a commitment, we know that there's a legislative commitment for the community safety and well-being plan. We see a commitment of community safety as a priority for the council. So I would like to see that the plan continue with support from council with the form of a committee so it doesn't lose momentum. That would be one ask. And I think that there's an established working group that was involved in the development of the plan. There are social agencies that are responsible for all of the action items there. We have sought and we're successful in through the Barrie Police Service seeking funding for the measurement too of the plan. So we'll keep bringing that forward so that doesn't lose momentum. And the next ask, if we need some support, not just in the core part of the core funding piece, but we're not there yet.
Just a follow up, Mr. Chairman. So I see that as being kind of in the longer term or a
Yes,
couple of
that's
next
correct.
steps. But is there anything today that you'd like to have us do?
I guess I would like to see that this project be endorsed by council, and that would help when we work with our community partners on this.
Okay, thank you.
Perfect. Thank you, Councillor Rima. Deputy Mayor Thompson.
Thanks. Through you, Chair, to Chief. Thanks for the presentation. We've had a lot of challenges with getting this organized, and I look at the community service partners, and at the infant stages of this, it was hard to get everybody together, and is some of our challenges because of the silos, and people don't want to collaborate because it's all about ongoing funding, and they don't want anybody to step on each other's toes because it takes money away. And, maybe to Mayor Nuttall's point, how do you feel that the community partners now see the importance of a collaboration than the silos? Because I look at some of the same players and they're becoming the barrier than the solution. So I look at a lot of the stuff, and I know because I wear another hat on the police board, and we spend a lot of our resources on the city's community and safety well-being plan. So is there a way that the people who are supposed to be doing this start doing this? And if not, is there a way to remove them and have another provider that was willing to collaborate?
That is a huge question, Deputy Mayor. We have community service organizations sitting at the table, and there is a willingness from some of them to make this happen. So when we have the large key organizations ready to bring this forward, I think it will be successful. And some of them are there at this point.
Just a follow up. I'm a big supporter of the diversion and the court diversion system. One of our things is we've been told, and from lots of smarter people than me, that people that seek support in their hometowns and stuff, in the diversion, would there be a plan that if somebody's not from our community, to returning them to follow out with the diversion plan, but in their own community? Because it's proven that people who go home basically are more likely to succeed because of the wraparound services. Is that part of the diversion plan?
It would definitely, and it is occurring right now with some of our partners through the Salvation Army and the Barrie Native Friendship Center and the Busby Center. If we can return people to their home supportive environment, that is so much better. And research, as you said, indicates that they're more successful, and that will be part of it. And we have seen the success in other justice centers that are able to do that also. It's not a big part because the justice centers that we visited, they're geographic based to support individuals in the community. But we do have some transient individuals that seek support in our city.
Thank you. Just before I go to Mayor Nettle, I want to jump in there. You, Chief Greenwood, you said if we can. Let me take Deputy Mayor's. You said if we can return them.
Yes, and it is not driven by the Barrie Police Service to return them. So if we can, through the Barrie Native Center, through the Salvation Army, we do through diversion programs that is being offered through the Elizabeth Rye to return them to their home community. And they do receive support from social agencies to physically get to their home community.
Do you have metrics on if they do?
If they do, I don't have that
And then,
front of me.
And then the clarification, Deputy Mayor Thompson asked the question about what happens if partnering agencies don't want to play ball. Essentially, they're not contributing. And do we have a process? I want to refocus the question. Is there a mechanism right now for removal from this plan and the table?
So the community safety plan model, the people that have been listed as the lead through the larger group, they're meeting their needs right now. Not all of them, but we're working on ensuring that they are meeting those needs.
So my question is there currently mechanisms for removal of members if they are not? I'm not saying that they're not right now. I don't have the evidence. So it would be.
So from the community safety and well-being plan, if there are individuals that are not meeting their needs, we need to have the committee to determine what are the next steps. And we don't have a committee established at the community safety and well-being plan at this point.
Okay, perfect. Mayor Nettle.
Thank you. Thank you, Mr. Chair. Sorry, Councilor Harris. Yes, thank you. I'm reading off of Councilor Harris's notes. You'll know where all the brains are here. Basically, one thing that we were just talking about on the side is, I believe through the community wellness plan, previously council supported and endorsed it. Is that correct? Maybe CAO Prowse? So at this point, I could be wrong, and I'm certainly if the clerk or the CAO would like to chime in. Is it required or is it necessary for us to then re-endorse the plan? We're a new council, but we're living on the shoulders of the decisions that were made before. Is that correct?
Through you, Chair Morales, to Mayor Nuttall. Defer to the clerk on the requirement to re-endorse. I don't believe there is, and I don't want to speak for the chief, but I think she was actually speaking of the Justice Center. Which is not, I think, in the original plan. I think this is a byproduct of that plan. Maybe I would return it back to the chief and she could clarify.
If you look at action number 4 in the community safety and well-being plan, it's developed a community justice center proposal. So we have been working with the Attorney General on that item. We are seeking to be the 5th pilot project. So that's one part of the community safety and well-being plan. Then we have the social services hub, which is another part of the plan. So we're looking at, in theory, to the support of the plan is there by council. It's been endorsed. Item number 5 is working on creating a community facility to support a social services hub. So the endorsement is that the city will be sitting on the role as an executive on the steering committee to support this part of the plan, because it's not directive or specific in the overall plan to say who is sitting at the executive steering committee level.
Okay, so who's structuring the executive steering committee?
There's a working group that I hope that we could mirror something similar to the Barrie Health Accord. And that would have city, county, RVH, police, public health.
And so you're looking for an endorsement from the city of Barrie to have an appointee on the steering committee, which is going to be created at some point in the near future.
That's correct.
Okay,
Thank you.
understood. Thanks.
Thank you, Mayor Nettle. Deputy Mayor Thompson.
Thank you. Through you, Chair Morales, to the chief. One of the actions of the diversion is sometimes it's drug treatment.
That's
Now, we all know that the availability for drug treatment right now is very scarce. So is there funding coming out of the provincial government, or is this something that we would do in the hub? Is that the goal, to have basically in-house, or is it the expansion of the RAM clinic? We've just opened the all-women facility in Barrie, but we would need an expansion because right now I'm hearing that it's 18 to 24 months for a bed. So how is one going to work if there's no availability? So is there any plan to increase the availability of?
We're
counsel?
hoping that we can. I do have a meeting tomorrow with the Solicitor General to bring forward that request, and through the Ministry of Health also. And there is a working group on this concept through the ministry. So it would be Health, Solgen, and the Attorney General working on this together. So I'm hoping through our contact at the Ministry of the Attorney General that this will be part of it. And there is a grant that is being written as we speak to address that treatment piece. Because once someone makes the decision to go into treatment, we don't have a very big window to get them there. Thank you.
Thank you for that. Any other members of council have any questions? Oh, Councilor Reitman.
Thank you, Mr. Chairman. I'm not really, I don't have a question, but and it's not really my place, but I'm just wondering if, since I'm not a member of this committee, I'm just wondering if it would make sense to pass a resolution endorsing the social service campus, including Justice Center. And that way it gets the ball rolling up through council, and then the chief would have her resolution of support for this that she can take where she needs to take it. And then we can maybe go further and appoint somebody to that steering committee when the time comes.
Perfect. It's follow up to staff based on Councilor Reitman's question comment. Can this committee, I don't think this committee can pass a resolution, but this committee could pass a resolution to recommend the endorsement to general committee. Is that an accurate interpretation, Ms. Cook?
To you, Chair Morales, the committee can pass a motion that will flow up the food chain to council for approval.
The recommendations, general committee. Okay. Well, sorry, your feedback is well taken, Councilor Reitman. I guess I'm going to ask Mayor Nettle, in terms of wording, is that something we want to do now, or is that something that we want to maybe say for staff to come up with language to be ratified at general committee?
Yeah, so I think there's a couple things on the comment from Councilor Reitman. First, I think that if we're comfortable as a committee, we should recommend that we move with an appointee to the committee. Secondly, I think we should be finding out, we as a city, we've endorsed the idea through different words of a hub. We've also already endorsed, I think, through points 4 and 5 in the past. Those are already endorsed. I think we should be going as the steering committee, whoever's there, getting information and then bringing it back. Because the hub, to me, when I look at the hub, I think it's a fantastic idea. Like if we're asking for the endorsement of just the hub idea, I think we've done that. And I don't know that anybody would be saying no to that. Maybe I'm wrong, but I don't think anyone would say no to that. I think the question is, what does it look like? Who's going to be involved when the rubber hits the road? And how do when I say community, I don't mean the community at large. I mean the community of social service organizations. How are they all going to interact with this, outside of it, inside of it? Like, those are the things that I think that, where the hub fell off the road last time, that we need to figure out through the steering committee. So I would like to see somebody appointed to this, if my opinion is being asked. I also want to see some of the meat and potatoes, if you will, after that steering committee meets, so that we can look at it as a council and general committee before, some of the structure before we go, yay, this is exactly where we need to go.
So would there be a wish to appoint someone before that first meeting or after that first meeting happens to kind of loop back?
Madam Clerk, are you, I believe we have some updates on some appointments coming in the new year. Is that correct?
Through you, Councillor Morales, to Mayor Nuttall. Yes, we are doing some committee appointments starting January 11th for the non-discretionary committees. So we could add that appointment on at that time.
May I ask through you, Mr. Chair, does that fit the timeline? Is January 11th an appropriate timeline for an appointment from the city of Barrie?
I'm sorry, did you ask me?
Yeah, sorry, Chief Greenwood. Is January 11th an appropriate
That
timeline
would
for an
be
appointment?
wonderful. Thank you.
Okay, yeah, perfect. So I think that we can incorporate all of that in if council or if members of committee and members of council are okay with that approach.
I see lots of curiosity on Councillor Harris's face. Go ahead. And then-
Yeah, thank you, Chair Morales. And just, I was wondering and thinking about sometimes how opportunity knocks and you try to fit things where they might fit, but not fit best. And I was curious if part of the calculation is the social service campus, which has been of interest in Barrie, and the opportunity, we know the province has been piloting some of these community justice hubs. If, it's about combining these two because there's opportunity, because there's funding in the community, in the justice hub world. But look at the partners, and they aren't here, and I can't speak for them. But I know for council, we've been criticized when we tried to connect homelessness, marginalized citizens with justice and law enforcement. So here we are putting them both together. And I'm also curious also as well, has there been discussion about the other Ministry of Health, Minister Tabolo interest is youth hubs. And so you've got the potential for a youth hub, potential for this justice hub. Has that conversation come up during these meetings around where does this fit with potential for a youth hub?
Microphone, Chief, microphone.
My apologies. The social services hub is one entity. We'd like to have that established. And once we receive approval from the Attorney General, we will embed a justice system into the hub. So we haven't got an approval yet from the Attorney General on the Justice Center. And I'm hopeful that that will occur within the next year. But having the social services hub will help. So when individuals do go through the judicial system, they're not cycling through because we are connecting to them into the services that are already established in the hub. So there is a pilot project that's going on specifically around youth in London, Ontario. So we will have some data from that shortly to see how successful that is or what changes need to be made. So when we're looking at the Justice Center here, I envision it to be for all individuals that meet a specific criteria to get them into the Justice Center, which would include youth.
Okay, and then is the youth pilot in London, is it a youth hub or a justice hub?
It's a justice. It's
Great, thank you.
justice.
Okay.
Thank you.
Perfect. Thank you, Councillor Harris. Councillor Hamilton.
Sorry, just a point of clarification. So I agree with the intent of having a justice center embedded in the social service hub. Again, I've done some research on that as well. I think optics are really, really important. And that was getting back to my question of who is leading this. If it's seen as the city is leading this with the Barrie Police and the intent is to have a justice center, it takes away the whole benefit and focus on the social service aspect. And even when you commented on the partners on the executive steering committee, I didn't really hear a strong stakeholder investment from the social services. So we've got the city, the county, the police, RVH, and public health. This is really about, integrating health and social services. So aside from the acute center and public health, I don't think we've actually got at the key stakeholders who need to be part of this table. So that would just be my one question. If the next steps are to assemble this executive steering committee, of which City Council will identify our representative, who's identifying the key members that need to be at that steering committee? Because to me, that could make or break this entire project.
So the conversations that we have had at the social services level, CMHA would be one very strong
Yes.
component sitting at the steering. So that was an oversight on my perspective.
Okay, excellent. That's good to hear. Because in my opinion, CMHA should be actually leading and driving this. They have the partnerships built already with the health and social services in the community. I think if it's driven by anyone else, perception and optics are going to play a significant role. So I think while I admire the police taking a leadership position in this, I just think we have to be very, very mindful that we don't get too focused on the justice aspect of things. And it really is the focus being maintained on the health and services. And we've got the right stakeholders in that community.
And the reason I'm supportive of the Justice Center being there is because we're not criminalizing individuals that shouldn't be in the justice system.
Exactly. And that's why, to Jim's point, I think where this has been done, it's been proven effective. Again, I just think perception and optics are really key because a lot of members of the community won't understand that at inception. So I think that needs to be secondary, kind of as you said, right? You build the social and community services first, and then after that, you sort of implant the Justice Center within it.
Thank you.
Thank you, Councillor Hamilton. Mayor Nutt.
Thank you. And really want to say thank you for the presentation today and the information that you brought forward. But more than anything, I think this is the final time that you'll be before members of council before Thursday's change. So I just wanted to say on behalf of the residents of Barrie and certainly on behalf of this council, thank you so much for the contributions you've made to the city of Barrie, to policing, to safety. It is you've had an incredible career for sure, but you've had an exceptional one here in the city of Barrie, and I know that going forward you'll be missed. But as I understand from our conversations on the phone, you're not going to be too far away, which means we still get to use your intellectual property, if that's okay, and I know how much you care about this community. So we really do want to say thank you so much and wish you all the best in your retirement.
Thank you very much to Mayor, members of council. It has been a privilege and an honor to be the chief of the Barrie Police Service, and I will continue to be part of the community and pay it forward and contribute as a citizen in our community. Thank you, everybody.
Thank you. Thank you for those words, Mayor Nettle. It seems anticlimactic to keep playing the meeting after that. Everybody go home. However, I know there was talk about possibly having some wording now. I liaisoned with the deputy city clerk very quickly and proposed a possible language, and I can't move this, so I just need someone to put it on the floor, would be that the establishment of a social service center campus, including the community justice center, be endorsed in principle. So that would be a recommendation that would be sent up to general committee for their essentially rubber stamping, anointment, endorsement, and it goes up the food chain. There was a bit of language about distinguishing the two. So it could be that the establishment of a social service center campus be endorsed in principle, and then a second paragraph, same thing, just with justice, to show a little bit of delineation, but I'll leave that to members of the committee and non-members of the committee to discuss. again, knowing the time, if there's something we want to do now, great. If not, we can wait to a future meeting. Mayor Nuttall?
I'm easy either way, but I would prefer we go to the steering committee and get some information, some detail, and then bring it back to this committee at that point to be able to say, this is exactly where it's going and what we're endorsing and how it's moving forward and who's involved and who's leading it and who's not. The last thing I'd want, I gotta be honest with everyone in the room, last thing I want is the city of Barrie leading this. So, you know, for whatever that's worth, and I'm sure that members of staff will be happy to hear that too, because I think it doesn't necessarily fit where we are. So I want to see the leadership come from the organizations that should lead it first, and we should endorse and support that behind that.
Perfect. Okay, that makes it easier. So with that, Chief, thank you very much for your presentation, your time to Barrie and this meeting.
Thank you very much.
So we will move on to, there's no standing committee items or committee updates because it's the first meeting of this committee and there's no referred items either yet. But we do have two advisory committee reports, and they are the last reports of the Senior Advisory Committee dated June 22nd of this year, and the Accessibility Advisory Committee dated September 8th of this year. And the last ones of those committees, because they will be amalgamating moving forward. Can I get someone to put
it on the floor as printed?
Deputy Mayor Thompson has put them on the floor as printed. Are there any questions from committee members, non-committee members? Nope, seeing none. All those in favor, please indicate. In favor, okay, perfect. Not opposed. And that is it. Could I, no, that is not it. An adjournment. So could I get a move for an adjournment at 1:59? Moved. Okay. Any opposed? No, we are adjourned at 1:59. Thank you, everybody.